closer to Heart Month, it's important to know your heart. In the United States, heart disease remains the leading cause of death for men and women. And in 2022, 1 in every 5 deaths was attributed to heart disease. Sonja Brune is an advanced practice registered nurse with Baptist Medical Network who has been specializing in the treatment of heart failure patients for over 25 years. Welcome, welcome.
Thank you.
So with all of the advances in healthcare, tell us how you focus on communication and education in your practice.
Well, that really is the foundation of my practice in caring for patients with heart failure, because there's been so many advances in cardiovascular treatment with decades and decades of science and clinical trials behind it. We know what is going to help improve heart disease and your function, but it's very overwhelming. If you've been diagnosed with heart disease and you come in and I simply just give you a list of medications that you need to take, you might not want to take those. Or if I recommend that you have some type of major surgery or procedure, you might not feel comfortable with that if we haven't just taken a step back and talked about what exactly is going on with your heart and why it's important to take the recommended medications or go through with recommended procedures.
And so what would you recommend to someone who's going to go see a healthcare provider about heart failure?
Well, first of all, if you've already been diagnosed with some form of heart disease, it's very important that you have a very good understanding for what exactly is going on with your heart. And if you don't, you need to ask. But what I really recommend you do from the get-go is make a list of questions that are most important to you, starting with, of course, what is my heart condition? Ask the provider, what is the most important thing for me to know about my heart? Now, if you don't have heart disease already and you're going to just be evaluated for possible heart disease, also make a list of your questions and, more importantly, your symptoms, even if you don't think they have anything at all to do with your heart, because that's going to give your provider a great deal of information to help make a diagnosis.
If someone is recommended for major heart surgery, what questions should they be asking?
I would recommend from the get-go that you bring someone along with you whenever you're going to have this conversation with the physician that's recommending it, because you may not think of the questions to ask, but you may also not be able to understand everything that's told simply because you're overwhelmed. I would first of all ask, what is my heart condition in reference to the procedure you're recommending, and what are the risks involved with this procedure, and what are the benefits, or how is it going to help me if I do have the procedure, and what are the risks if I choose not to have this procedure, because you still do have that right to refuse treatment. And then if you choose to proceed, what is the time that you're going to be in the operating room, and what's your anticipated recovery time? So it really empowers patients to be involved in their care and to have all of the information so that they can make the decisions with regard to their care.
Sonja Brune, thank you so much. You only have one heart, so take good care of it. To find a cardiovascular provider, call 210-640-5943 or visit the website baptistmedicalnetwork.com/heartcare. Sonja, once again, thank you so much.
Thank you.